Good morning, everybody. I think we just have a few people still signing in, but I don't get enough time to spend with you. So I want to get started to share a little bit about our program and to welcome you to Azusa Pacific University. My name is Michael Wong, Dr. Michael Wong. I am the orthopedics professor here. And I have been here, it must be about 17 years now. And I have not had a more fun time in my life. Every day, I'm excited to be with my students and to train them to become the best physical therapists that they can be. Our dream always is to be a launching pad for you to go out into the world to become the best in our country, I hope in the world, and also to be able to serve people. Because when you're really good, you really enjoy what you do. Okay? So just yesterday, we've had orthopedics 3 days in a row. I get to be with the students 5 hours a day for 3 days in a row to shape their mind to become clinicians, right? It's not just about teaching you what you need to get ready for an exam. It's to teach you how to serve and to be able to clinically reason and really help people. How fun is that, right? So I wanted to share with you a little bit about our program because I know there are many great programs in the area. And we want you to get a good glimpse of what our program is like so you can make the best decision for you. We have a lot of cool stuff for you to see, our new department. We have a lot of the students coming in to do a Q&A. I think there's no better people to ask than the customer, right? The person who says, I'm here to learn, am I getting what I paid for? So I think that's a very valuable time for you guys to engage with the students. So what I want to say here is that APU is a Christian university. And the motto here is God first. All of the faculty are Christians. Now, it doesn't mean every student is Christian. That is not a prerequisite to get into our program. But you'll know that all the faculty are, okay? And we like to bring in our own Christian worldview, how we integrate into the clinic, how we teach out in residencies and fellowships. Many of us are teaching in residencies and fellowships as well. I just got back from 2 weeks in Beijing where I was mentoring fellows and residents, treating patients in China and trying to raise the level of care there. It's fantastic, right? What's cool about this program, I think, is that everybody knows your name, right? So you saw me come and try to meet you. I'm trying to learn my students right now. I've only had 2 weeks with them. They each have a little name card, and I try to call them by name because we believe that each one of you, we are going to be investing energy, knowledge, time into each one of you. And part of that comes out of a relationship between your professor and student, right? So it's the same way with your patients, right? The patient needs to know that you matter, they matter. And so I think we try to do that same thing amongst us as well. So why am I here? Why are you here? Well, there are many flavors of PT programs in California alone. I mean, think about Southern California alone, right? So you want to be able to know what kind of program would match how I want to learn and what kind of therapist I want to be. Okay? I have a lot of great colleagues in all the different programs. So your goal is to get a taste. What is this program like? Who are the people? What are the students like? What is this environment like? How do they teach? I hope to give you a little glimpse of that. Doctorate programs also do not cost 99 cents a scoop like ice cream. My kids recently, our local Baskin-Robbins, I was like, wow, $3.49 for a single scoop, something like that, right? You could say that for grad school too, right? It costs a lot of money. It's going to take a lot of effort. You better get what you came for. So I think that's really important because your career and all the patients waiting to see you depend on you being a great physical therapist, right? So it's not just about the money, but it is always a little bit about the money, right? You want to know, are you getting the best education you can get? So, of course, as you know, we are here not too far from Pasadena, not too far from Disneyland, not too far from skiing, really. A lot of fun things to do. You know what the students are doing after class? They're downstairs hanging out together, studying, talking with professors. It's unique to be in a cohort together for the next 3 years. I think of PT school as one of the most fun graduate schools you can choose. right? So there are a lot of nice things to do in the local area. You can see that this West Campus, Azusa Pacific has an East Campus and a West Campus. This is the newer campus. This is our brand new building. And this program is well valued in this university. We have everything that we've dreamed of because we are in the business of making great physical therapists. The Felix Event Center, of course, basketball. We often go over there to play basketball with the students. You've seen the Darling Plaza. It's quite nice. Students are out there at lunch every day, hanging out, enjoying the outdoors. The library is beautiful. Oftentimes they'll have the music majors doing concerts in there, your lunchtime concerts. So you kind of, it's small enough that you can kind of access a lot of things. You came through the art gallery. I walk through it every day. The art is beautiful. I'm a scientist. I have no idea what's going on in there, but it's beautiful, okay? So, but what a great way to enter the department. You have a little prayer wall. Students are gathered here. I think it's a nice balance, you know, a small university with a big university feel. So it's kind of nice. There's a lot of music, okay? The singing, the musicians are, APU is well known for that. You have theater, actually right off of the parking lot that many of you parked in. There's a nice theater where we have lots of fun things to go watch throughout the year. And of course, the athletics is pretty good too, right? So this is one of our alumni, this Olympic gold medalist, Brian Clay. So it's kind of a cool place to be. I mean, I've been here 17 years and I have no desire to go anywhere else, okay? To serve, to support, and to nurture the students into compassionate and excellent physical therapists, right? That's kind of our department motto. Because healthcare today is busy, rushed. But rehab is a relational, very relational business. Patients need to know that you care, that they're not just your 730, right? And so we hope that in your interactions with us as professionals, as physical therapists, and your interactions with us as faculty, you will also see the same level of care, of desire to be a part of your life, to help you get back to where, you know, for the patients to get back to where they need to be to function in their life. That's so important. So who are we? Who's the faculty? I can tell you that the faculty are a bunch of really brilliant, really fun, kind people. That is one of the reasons I think faculty stay, right? It's because the people you work with are very important. Do you believe in the same thing? Do you push the students to the highest level? Okay. So Dr. Shore, who is our chair, actually, she's a very hands-off chair. She says, whatever you need to do your job the best, go for it. Faculty love that, right? Dr. Chung is in charge really of acute care physical therapy, and she is a big part of getting you ready to find good clinical sites for you. They spend a lot of effort trying to find good clinical rotations, because it's hand in hand, right? What we teach you here, there's a handoff into the clinical environment where you then try out all your new tools. This is Dr. Happy, Dr. Kumagai Shimamura, and she is giggling and laughing down the hallway all day long. She is one of the most well-respected physical therapists in Southern California. She's a neurologic clinical specialist. She's an orthopedic clinical specialist. She teaches in most of the residencies and fellowships in Southern California, right? This is Dr. Grace Matsuda. She's part of Gross Anatomy. She's also part of the acute care rehab team and also helps to find good clinicals for you. So finding good clinicals is a very important part of any PT program. It's amazing how hard they work talking to us faculty. Hey, do you think this person would fit well here? Would this be a good match for that personality? So I think their investment of time into making sure that that part of the learning is good for you too is really valuable. There's me, eager, excited, uncontrollable, having fun every time I'm with my students, and always dreaming of new ways to improve teaching and learning. So here at the university, I'm a teaching and learning fellow. I've got a chance to learn from a lot of teachers how to teach. And also spend a lot of time figuring out how to build apps and build cool technology to change the way that students learn. So I'll give you a glimpse of that later. And my primary job here is to dream, to help the other faculty dream. We've built apps for almost every faculty member to enhance the classroom and actually to spearhead that type of thing to change physical therapy education and take it into the next, to the next level. This is Dr. Tamara Eckelberger, and she teaches neuroanatomy. She helps a little bit with research as well. Dr. Dan Farwell is my wingman. He is Goose to Maverick. We are both in ortho together, and we have a great time teaching, learning, growing together, bouncing ideas. He has lots of great experience in the clinic and also teaching at other universities. Dr. Patterson is the quiet but solid guy who is building amazing things, and some of his PhD work we'll be building apps out of. He built this amazing gait analysis, or learning about gait and human movement. We built this amazing app that will change the way you'll learn about movement. So amazing guy, also one of my wingmen. And then this is Dr. Annette Karam. She is an amazing physical therapist, highly trained, PhD as well as fellowship, and also involved in dance medicine. So she presents all the time, performing arts. She is, I believe, the chair or president of the Performing Arts Special Interest Group. So right now we're doing research and we're analyzing how dancers dance and how they move, and we're using slow motion camera and all kinds of cool stuff. Dr. Derek Swiecki is the director of the DPT program. Another genius, super fun, very involved in the profession at the pain science level. Pain science is a very big deal, chronic pain. And so he is one of the guideline writers for chronic pain education, and a genius clinician in and of himself, and then an amazing researcher and amazing colleague. So really, it's really a stacked team of really cool people. Dr. Kathleen Tallman, PhD, also involved with our anatomy class, neuroanatomy class. Her time is spent primarily in the anatomy lab with you. And then we bridge the gap to try to make gross anatomy into clinical anatomy to make it really meaningful, right? Dr. Mary Hudson McKinney is a professor in neurorehab, very well known in the area as well. She's just recently joined us. I think she'll be an amazing addition to the neurorehab team. And then Dr. Ababao Johannes does statistics, cardiopulmonary rehab. Again, a lot of really great people. Dr. Melissa Cole, we're just finishing up building a pediatrics app. We filmed a baby, how a baby develops, so you don't have to read about it. You can just watch the baby and see how they change every month, right? And see how they move different every month, so you can learn, oh, that's what normal looks like, so I can pick out when babies are delayed. So you can see how a lot of the time we're investing is trying to figure out what are the tools we have to help you learn and how can we make them better, right? So the goal of physical therapy, restoration of function and optimal well-being so people can move pain-free. You can restore pain-free movement so the population can have a quality of life, right? It's a big deal. It's a really big deal. And how are we going to do that? So as a Christian physical therapist, to serve our hurting world with our God-given skills, right? Each one of you have different personalities, different skill sets, to bring a message of hope about Jesus Christ to our patients, right? And everybody's going to do that different, right? So faculty will often share little experiences that they've had, and then in your own journey, you'll do it your way, okay? Or not. I mean, everybody has their own way of caring for people. So you see the students here. This used to be me and with them in modalities. They are debriding a wound on Mr. Orange. So if Mr. Orange bleeds, that's not good. And the rind is a lot like wounds, right? The scab of a wound, okay? So many times different professors will pray before class. We think about common conditions. What is the evidence behind how to evaluate them, treat them, exercise them? And we try to tie it together all across the curriculum. The reason why we built apps was to be able to build a bridge across content that is siloed in one semester after another. You can imagine, right? therapeutic exercise 1 semester, evaluation 1 semester, treatment 1 semester, how hard that is to try to pull it all together. But imagine if you had a tool that could always weave those connections. Every step of the way, you could weave those connections. It changes the game. It really does. And enhance physical and functional abilities. So, from the program perspective, as many of you who have already applied, and this is fairly common among the different programs, this program is a 31-month program. You're pretty much going year-round. It's going to be busy. Your bachelor's degree is required, your minimum GPA, your 3.0 or above, minimum science GPA. I would say this. When you think about the GREs versus the GPAs, everything is on kind of a scale. After you hit the minimum, you want to think about, how do I balance the scale of my GPAs a little on the lower end? It may be worth it for me to try to get my GRE up, right? Because we think of the GREs as a way to get a sense of your academic horsepower, right? So if your GPA is already very good, then you just need to hit kind of your minimum, so you don't get flagged. Okay? So there's an automatic mechanism that is, because if you imagine there's 1,000 applicants or more for most programs, probably more, vying for these spots. Okay? We also interview everybody that we accept. It would be easier just to take everybody by numbers. But it is very important who you are, what you have done. Okay, what is your story? Okay, so something to think about. Some core classwork. This is the standard core classwork that you need to you must have taken. In the rare occasion, you would be able to talk with the NEL about, hey, does this count for this? Those are conversations that many of you are already having with the NEL that I think you can just pick up. But in general, I want you to think about your GRE scores should be within the last 5 years, and I do believe it is very valuable for you to have experience, particularly, I mean, if you did it all in one place, that's okay. It's kind of good to see a few different areas, if you can, because you really want to know, is this the profession for you? There is sacrifice. It will be 3 years and 100+ K, and then a lifetime of busyness. But if you are good and you loved this profession, it is a fantastic place to be, right? So I really think that it's valuable to expose yourself and say, man, I can totally see myself doing this. I can't wait. Or, man, I can't handle that. Patience, a new person every 30 minutes, can't do it. That's okay too, right? But you want to know before you put in the sweat investment and the monetary investment. So I think that's important. Just a quick glimpse of the process. So when you are done submitting into PT-CAS, you have to think that PT-CAS is processing and sending information when your file is complete to the Graduate Center. And the Graduate Center does its first round of kind of like sifting through all the files to make sure all the minimums and all the things are there. From there, it'll take a couple of weeks to get to the PT department where Anel and the team, we start to look through the files and try to figure out who we can get for interviews. 4 to 8 weeks is what's happening here because we're processing a lot of files, and then the interviews happen, some of which many of you are here for interviews today. Some of them we do online if you are from out of state. And eventually it takes 2 to 4 weeks to get a response from the interview, because when the interview is done, we bring all the interviewees, the files, back to the full faculty. And we allow the full faculty to have some say into who is coming into the program. Okay, so there are many things that, this is not just a take a number, you're in if you make the number. It is we care deeply about who we'll be working with for the next 3 years. Okay. So there's a lot of cool research that's going on. Dance research, pain research. We're doing a new project on social media and anxiety and depression and pain sensitivity. It's interesting stuff. And a lot of basic science research, physical therapy, manual therapy type research. And the students have a choice to be involved in things that they're interested in. Meaning we don't force every student or student pair to do a big research project. you will have things to do related to research that will help you to become a research-consuming and analyzing clinician, but not everybody came to become a researcher. So for those who are interested, you piggyback with, or you join a faculty with your new idea. The faculty helps you flesh it out, and you pull it together, and you go for it, and the faculty walks side by side with you. So there's a few who are doing some great research projects and who are now presenting at this recent Tri-State Conference in Las Vegas. We have some amazing projects that the students have pulled together. So the point is, we've decided that that is not the best use of your time to force everybody to do research. You're here to become a clinician. And then we provide for you the opportunities to do it if that is your bent, right? That's something you're passionate about. So this was our department. Today, what you see is the university investing in one of the best programs in this university, right? So we've just recently moved in. There's places for the students to gather, right? You saw that as you came in. Places for the students to play, eat, study. Yesterday I was hanging out there with the students answering questions because Ortho 1 is intense. Lots of growing, stretching of your mind. This is just this morning. Students happily learning together. You know, imagine before our program got bigger, right? Because we accept about 74 students a year-ish. They first built us a space that would optimize learning instead of forcing us to grow so that we have enough money to build a space. Does that make sense? They got me wingmen first so that every student would have a professor to find, to learn. That's the philosophy of how APU works. So I think that's valuable. That values us. Instead of saying, you're going to grow, you have to grow, and you're just going to have to make it work. Right? It's different. So this is yesterday, actually in lab. Students were all learning their first lumbar manipulation. We just prayed. Good luck, everybody. The spine is strong. Let's do this, right? You got to start somewhere. But, you know, there's a graded process as we teach how to do these high-level skills. We started 2 weeks ago. We introduced different pieces of it. And then they get better and better. So we take the luxury of time for some of these higher-level skills. And the other stuff, we just play together. So yesterday, they did their first evaluation. It was chaotic. It was crazy. But you cannot build, you have to build these types of environments for questions to arise. When you're facing a patient wondering, should I have done this or done that? You can never get to those questions just from lecture and lab. And so we build a lot of these experiences in because I've come to believe that we can teach less from here and build more with you. Build the house, not just give you the tools. And we'll just do it over and over again until you get comfortable. And I think it reveals itself when you come out into the clinic. When the clinical instructors say, man, something special about the way your students come in. It's because we spent all that time in a safe environment for you to learn to become who you need to be, instead of hoping that's going to happen later. Right? It's very, very critical, I think. So there they are doing their evaluation. Everybody's thinking, why did he do that? What test should I do next? What did that test mean? Right? All of that's happening in those moments that you have to reserve, because to create clinicians, you can't just deliver content. Okay? So students are doing research. They're presenting research in different places. This is one of the research projects done at Big Bear. Everybody wants to know how our students will do to pass the boards. I want you to know that, of course, the data is always delayed as we're gathering the data, that APU is generally above national and California average. We train you first to be amazing clinicians, and then passing the boards is a no-brainer. Okay? So I think that's the way we hope to focus how we spend time with you. First, teach you how to think, and then all of this stuff is just secondary. Right? So a glimpse of taking learning to the next level. PhysioU is something we've built. I've built here. And each of the faculty members have been able to say, hey, I really need this for my class. Can we build this? Can we build that? So let me give you a quick glimpse. Actually, I would say this also, that as a residency and fellowship trained clinician, one of the things that happened while I was in my training was I realized that it is very useful to help young clinicians, students, learn about patterns, common conditions that you're going to see in the clinic. To not necessarily teach you about every possible thing that you could see, but to make sure you're really clear about how to help the most common things. And that clarity gives you confidence and something to practice with, right? And so clinical pattern recognition is, in the research, the way experts practice. They can see someone, hear someone tell their story, and immediately it triggers these past things that they've read, past patients that they've seen, and they can apply that past knowledge, the pattern recognition, to then streamline the exam, streamline the treatment to the most effective treatments. It's very important. Experience does not guarantee that you become an expert. Okay? So taking all of these books, all of these clinical practice guidelines, and then building them into an app that you carry in your pocket from the first day of PT school here at APU all the way for the rest of your career. Right? Every single one of our students will have access to this. And just as a glimpse, we have been building these things for a long time. All the orthopedic regions, range of motion manual muscle test, because that's really painful to read about, right? But you could watch a video once and learn how to do it. Cardiopulmonary rehab, neuro exam, gait analysis, assisted device training, therapeutic exercises, special tests, P&F, patient education, and a whole slew of other apps that we're about to release, working on. Okay, all related to the idea that we think that we can enhance teaching and learning with these different resources. So let me just give you a quick glimpse. So imagine, let's see. Okay. So this is the baby app. We are building the interface for the baby app. So you can see that right there. I'm going to take you right in here. So these are the apps that we use to learn. So imagine learning about analyzing gait and not having to look at stick figures, but looking at real-time range of motion gathered in our lab. Right? Here's the range of motion of what's happening at the hip, the knee, and the ankle. Looking at what's happening with the muscles, real-time EMG data, so you can analyze movement and understand why muscles are doing things. Right? So if you look at this limb here, her anterior tib needs to start firing or she's going to drag her toes on the ground. And once her feet's down on the ground, that can quiet down. That's the story of human movement. We are going to build apps related to all the different areas of human movement tied to this. Okay? So, or orthopedics. You could say, hey, I have a shoulder problem, and my pain is all over my shoulder through here. Okay? Or here. So our students will learn to generate hypotheses. Oh, I think this might be a shoulder impingement, subacromial pain syndrome, or maybe like a frozen shoulder. And so they can then learn about the prevalence. They can learn and watch videos of how these patients might present in the clinic. Can you see the pattern growing in your mind? And then I'll say, hey, what kind of things are you going to do in your exam that you think we're going to learn on Thursday? Oh, I think maybe range of motion. Perfect. I think maybe like glides of the shoulder joint. Perfect, right? Because that's what happens with frozen shoulder. They lack range and they have stiffness. And so you begin to set the context for what they're going to learn on Wednesday or Thursday, instead of saying, well, that's shoulder. Here's a list of 200 things we're going to learn today. So every Tuesday, we play out these patterns. They are pre-exposed to the techniques and the tests. Categories of conditions are built into their mind, and then they're referencing it all along the way. So they're pre-exposing themselves to lab. They're using the apps while they're in lab. They're using the apps afterwards to organize all the content. That is far advanced from just having 30 pages of 300 techniques that you're going to have to get through in the next 6 hours. You see what I mean about how you organize the student's mind changes how they manage the volume and access what you are learning. It gives meaning to the content that we're teaching you, right? So you can see all of the manual therapy, all the special tests, the examination, clinical reasoning videos, differential diagnosis, things that I can't even teach you yet because I'm teaching in sequence. I'm already tagging in your brain so that you'll be ready for it. You see how powerful that can be? Okay, so therapeutic exercises, modalities, taping, all of that's built in, condition specific. So that's just a little glimpse, okay, of what's, neuro exam, special test, splinting app. We've built apps with different professions as well. That's kind of a little glimpse of what we've been building to enhance your learning experience. So let me take us through just this last few slides. So we always have an APU sports day. APU sports day is when all 3 classes finally get to hang out together, right? So you get to meet each other, we play fun games, different sports, and everybody's we have a little taco truck, or taco guy, and you have, you're out there playing together, right? So the program has grown over the years. And the good news is the faculty have very clear vision of how we need to teach, which means we go to the chair and we say, these are the critical experiences that we must have resources for, no matter the size of the class. And so, one, they built us a new space for us to go wherever we needed to go. We needed space to do the things that we need to do. Mentored evaluations is a big one, where you get to you as the student get to be the PT on the patient, and there's an expert there to mentor you as you practice and try. And it is not a graded experience. It is a learning experience. And then eventually, as you get better at it, it becomes a graded experience. Okay? So also, that's inbuilt into my orthopedics class over and over again. There will be no question by the time you are done, you will be good. Okay? Because I've seen it. We would have seen you practice. So we lots of times go and do fun things together. Of course, the students, I believe, are studying all the time, but it looks like they're having fun all the time too. So I think that's what's special about this phase of life. And they're all getting close to graduation day, right? This is the big day. This big moment that they've all been waiting for. To finally get to, that graduation day where we then welcome you as colleagues into the profession. Proud of you, trained you to be the best, launched you into residencies and fellowships. That's the dream for me, for most of us, because we're all residency and fellowship trained. So why our program? We're a Christ-centered education program. It's a close-knit family environment. It's nice just to be all in one place. And then our tuition costs are very competitive with any of the other programs, the private programs. And the small class sizes, I would say we've broken the groups so that we always have access to the groups, and we are actually reaching out to make sure that students, this year we've implemented, will have faculty advisors that you'll meet on your first day that will be a part of your journey throughout, so that you always have someone on the inside that is caring for you and taking care of you, okay? And then clinical courses are coordinated and taught by core instructors. So that means that an orthopedic course, which could be driven by 3 different instructors, examination instructor, treatment instructor, therapeutic exercises instructor, is actually me driving the whole series. So the way we test, the way we train, what you need to do, it's not this new experience every time you hit a new professor. I think that's quite important as well. Okay. So we have an early January start date. We have state-of-the-art equipment here. There's research opportunities for you as young clinicians and students. Outstanding Christian faculty. I really believe that these colleagues are really amazing people. Residency opportunities, meaning we really hope Southern California probably has one of the highest densities of residencies and fellowships. We would like you to go there because it is the fastest pathway. It's a rocket ship to expertise, right? So state-of-the-art teaching methods and styles, as you've seen, and residency and fellowship style mentoring. Many of the residents and fellows are alumni, come back to help mentor the students as they go through their clinical courses. So there's many post-professional residencies. Kaiser is a big one. That's where most of us graduated from. Casa Colina nearby also has a neuro and orthopedic residency. And we have many students. The number just keeps growing and growing. Again, because I really believe that when you are trained at the highest level, you have many opportunities. You don't just move laterally from clinic to clinic. You have many opportunities to help in different programs, to help with continuing education, to help overseas. We have residents who end up going to Beijing or to different fellowships with me and with our different programs. And we have one of the highest annual residency acceptance rates. We have a very high number of our students who apply, and we also have a very high number who get in. And we're happy about that. We're excited for you. So it's not just about school, it's really leading a purposeful life for others. That's a little glimpse of what we do at APU. So the question is most of the research done after the first year? The bulk of your first year is kind of basic skills like range of motion, MMT, gross anatomy, and then orthopedics at the tail end of that. And then kind of like the tail end of year one is a lot of the clinical classes, cardiopulmonary, orthopedics, neuro rehab. And research kind of comes after we've taken care of business. And then from there, you have a smattering of research classes interspersed because you kind of need to be able to read research and understand research while we're going through these clinical classes. But then the research projects, like the capstone projects, come towards probably the later part of the program. You know, the second year, third year is largely clinical. So a lot of it is done in the second year or late second year. So the question is, what is the value of residency and fellowship in the profession? Well, remember that from my perspective, if you think about the medical profession, none of them practice, for the most part, until they finish their primary care, family practice residency, their orthopedic residency. Most programs we do a reasonably good job at preparing you for an entry-level job, okay? You're decent. You can start practicing. My belief, and the belief of many who are in residency or in the residency and fellowship world, is that there's many great things we can help you grow and become an expert faster by giving you regular mentorship in the clinic. We see patients with you, except you are with a bona fide expert. And the courses that you take on the weekends, just finished teaching one of the courses for the residency this couple weeks ago, what they learn there, the mentor knows and is going to mentor you based on that stuff. So it's very different from just taking a weekend course and trying to apply it yourself. The other thing I think about is, if you think of PT as a whole, where we were once a bachelor's degree, then a master's degree, and then a DPT, one of the reasons why it's valuable to have a residency and fellowship pathway is because within the medical professions, it is a respectable pathway that people understand. So your profession also has residency and fellowships. That's very respectable, right? So I think it is a pathway of clinical learning that's very valuable for you as a clinician, and it will give you many opportunities in life. The question is, for the clinical experiences, are they abroad, mostly in state or in other states? For the most part, they're in California. But it is also semi-flexible in the sense like, hey, I live here. I have clinic sites that I'm familiar with or I know are very good. Can I do my 3-month clinical at home? And then you just work with, there's students that do that for sure. And so you would just work closely with a clinical coordinator to try to set that up early. Yes, so like any other program, the question is, does APU allow for exposure to different settings in PT? Remember that all of these programs in the United States are expected to ensure you are a generalist in multiple areas: acute care, orthopedic musculoskeletal care, right? So neurologic. So you have all of these different areas, and you will be given a clinical in each one of those areas. So everybody's going to be exposed, and you should totally take advantage of it, because it's much harder to say, I'm going to switch from ortho to neuro once you're out, right? So you want to be able to get a glimpse and see what you connect with, and then you focus after that. The question is there a certain setting, particular specialty area that is a focus of the program? I would say there isn't. That every program is expected to teach basically the same stuff, right? I would say our focus, though, what we do really well is building clinicians, not just people who are covered in tools and don't know what to do with them. So this is a very important distinction, because as numbers grow, as more and more information comes into a program, every faculty is burdened with not enough time and too much stuff. So in order to be focused on creating really good clinicians, a faculty member has to be willing to say, this is what should be taught. Not everything. You can learn a lot of other stuff later. But I need to create experts, entry-level experts today, with what they have to know, and then create experiences to allow you to get there. Volume, I believe, is the enemy of learning, right? Too much means instead of coming to a fork in the road where there's 2 forks, there's always 7 forks. How do you know which way to go? 7 techniques to do the same thing. That's a ton of stuff that you're going to have to learn, right? So then we carefully sit together, the whole ortho faculty, sit there and trim stuff. Is that the best special test, or can we trim it? Do they really need these techniques, or can we give them the best one and let them learn the rest later? Trim it, trim it, trim it. So you have a little less stuff, but you know what to do with it, and it's generally the best stuff. So the question is there opportunity for specialization within the program? I would say that there's not very much time. It's pretty packed. Now, the students who are like, man, I'm totally into peds, they probably start hanging out with a peds professor more, looking for opportunities to shadow, getting set up with going to the good clinical sites for peds. And then I think what we hope to do is, now I'm not sure if there's a pediatric residency, but whatever area you are focused in, we hope to help kind of launch you into that residency direction. So I think specialization really comes after you take care of the basic business first, and then of learning to be a PT. But I think the research opportunities, shadowing the professor or where they're at during their doing their clinic work, those become things that you just naturally kind of end up doing because of your interest. Yes, so the question is there integration among the different healthcare professions? This is another very big area, emerging area in physical therapy. So we have these big, like multidisciplinary meetings where you have psychology, social work, nursing, all coming together to look at the patient together and have discussions so that we're better able to interact, better able to understand what each group does to serve the patient better. So that's happening across the states in all the programs. That we recognize that if we only stay siloed in our own little PT world, the patient may not be getting the best care. And so yes, that is happening, and that happens in our program as well. So thank you very much for hanging out with me this morning. And I hope this is useful for you as you're making choices for your journey. So thank you.